Good afternoon. Welcome to our third and final town hall in this ongoing series. I am Reverend Dr. Waltrina Middleton. I serve as the Executive Director with Community Renewal Society. Community Renewal Society is a 137-year-old nonprofit organization committed to eradicating racism and poverty. And we are committed to a vision of beloved community, inclusion, justice, and faith. The latter is very important because we are unapologetic in our belief that to identify as a faith-centered organization also means you are centered on social justice. The two are not exclusive. And that is why we are here today and why we have hosted this three-part series town hall called Color, Culture, Class, and COVID-19. Our first town hall was entitled A Bomb in Gilead, Health Disparities. Our second, Jesus and the Disinherited, addressed socioeconomic disparities. And today, our third and final town hall is called Ubuntu, I Am Because We Are, looking at the impact on the global diaspora. At the intersections of our faith, we are also wrestling with issues that predated COVID-19, such as xenophobia, classism, militarism, and apartheid systems of occupation and marginalization, sexism, and other social disparities like state-sanctioned violence and the inadequacies of healthcare. Today's town hall reminds us of the words of John Donne: "No one is an island entire to itself. Everyone is a part of the continent, a part of the main. And if a clod be washed away by the sea, humanity is the less. Anyone's death diminishes me, because I am a part of humankind. Therefore, never send to know for whom the bell tolls, it tolls for thee." And of course, I took some creative license there to be inclusive. But today I hope we will each be reminded of our shared humanity. What does Ubuntu mean? It is a Xhosa terminology of humanism. I am because we are, or our universal bond connects us all to one another wherever we are. This surpasses even geographical boundaries. Diaspora, in the same spirit, for me, speaks to our interconnectedness in humanity. When I say diaspora, I recognize we are all descendants of the African continent. Some descendants were stolen from the land and were unwillingly forced away. Yet, while we may reside in different locations outside of our place of origin, we remain universally one. If this is true, if the spirit of Ubuntu applies, how do we now examine the impact of COVID-19 with global lens? Are we concerned about the health, survival, and care of those outside of Chicago, outside of the United States? When we call for comprehensive research, equitable access to vaccines, and inclusive measures of prevention, who are we speaking of? When mainstream media covers this global pandemic, will the coverage report on countries outside of the US, Italy, France, and China with the same urgency and intentionality? Right here in the US, where we have the highest volume of cases and fatalities in the world, which communities disproportionately make up those numbers? And are we covering the impact of COVID in the First Nation communities here in this soil? How do we ensure the safety and care for those detained persons at our borders in immigration custody? These are the questions we will explore today. Today, we welcome our panelists, Jacqueline Keeler, Editor-in-Chief of Pollen magazine, Omar Haramy in the occupied state of Palestine with the Sabeel Ecumenical Liberation Theology Center, Reverend André, Guimãraes, pastor of Methodist Church Philadelphia of Brazil, and a longtime human rights advocate across Brazil. Faith Tanui Chelangat with Hekima University College in Nairobi, Kenya. And she centers her work on strategies for peace building and human rights. And finally, Craig Mousin, adjunct faculty with DePaul University's College of Law with refugee and immigration law as his focus. We will not cover everything, but we're so grateful for this time together. I wish to welcome all of our speakers, guest panelists today. And I want to begin with this quote from James Baldwin. James Baldwin's public letter to Angela Davis stated that her fight is our fight. And if they take you in the morning, they will be coming for us that night. The totality of Baldwin's letter is moving to me and invokes feelings of deep love, solidarity, and consciousness. Who is the they and who is the we? Baldwin makes clear that David's cause is not isolated, but it is a collective responsibility for each of us. In this moment of COVID-19, I ask each of you, are the sentiments that Baldwin expressed still true? And if so, or not, can you share your thoughts about our collective responsibility in sharing in this moment right now? Let's start with you. Brother Mousin.
Thank you, Reverend Milton. It's an honor to be with all of you, and also chilling to hear that quote, because even as I speak, the Department of Homeland Security is deporting young unaccompanied minors back to their countries out of detention in the United States. And there are reports, even as recent as yesterday's New York Times, that children are being taken from their beds in the middle of the night and not told anything and put on airplanes, perhaps 2 or 3 trips around this country, and the next thing you know, they're in Honduras or Guatemala. Others are being refused admission to follow the law and seek asylum, and are forced to go back to tent camps in Mexico, where in the middle of the night, gangs or other criminals can attack them. So it's very chilling that both at the border and in our own cities, people are still at risk for being taken out of their beds at night.
And Jacqueline Keeler, we're glad to have you here with us. And I understand that there are numbers that are not being examined in terms of the impact on Native communities. And when you hear the quote by James Baldwin, I'd love to hear your reflections on that. I know that following only New York and New Jersey, the largest cases per capita in the US in terms of infection and death are Native American communities, particularly the Navajo Nation and Hopi Reservation land have the highest numbers, over 3,000 reported since March. I'd love to hear your reflections and thoughts as well.
Yeah, I am a citizen of the Navajo Nation. My father is Yankton Sioux, but my mother is Navajo. And I have a piece that came out this month in Sierra Magazine. I had the opportunity to travel across the Navajo Nation in January, shortly before the outbreak of coronavirus on the reservation. And yeah, I've been running a coronavirus podcast, and I think that that our struggles are united. I think when I look at what's happening on the Navajo Nation and in the country generally, the reason why Native people are so vulnerable or directly tied to is basically systemic racism, and to the and I think that the bigger virus, the virus attacking America, is really the virus of white privilege and white supremacy. It's why we have a government that isn't taking this seriously, because it was voted in by primarily people who identify as white. And so so with the Navajo Nation, we just did a look at the data with some Native geneticists yesterday, and there is a bit of a correction in the way the media portrays the issue. The Navajo Nation is testing a far greater percentage of its population than even the state of New York. We've tested about over 11% now, going I think on, and so the state of New York comparatively has tested 7% of its population, and I think the U.S. is just above 2.5%. I mean, so the numbers are going to be greater because of this, and so I think that gets lost in the coverage. That just the way that I've noticed this across Indian country, that Native people and Native communities and tribal governments have really addressed this issue, paying a lot more attention to the science, much more seriously, especially if they're in red states. Of course, you see in South Dakota and in Arizona, the governors there did not take the issue very seriously. and weren't really enforcing a stay-at-home order. While on like the Navajo Nation, they actually have whole weekend lockdowns where people are fined $1,000 for being out. So the level at which, and then of course, we had a show last week where we talked to the chairman of the Cheyenne River Sioux tribe. And of course, the governor of that state, Kristi Noem, is appealing to Trump to try to get the tribes to take down their COVID-19 checkpoints. And legally, they have the right legally, they do have the right to, the tribes do have the right to have these checkpoints. The state of South Dakota, according to an Eighth Circuit Court ruling in 1990, has no jurisdiction over the roads that go through the reservation. The tribes are sovereign nations, and our only relationship is a federal one, not with the states. The states are a lower sovereign entity. And so she's trying to appeal to Trump to basically go in and take down these COVID-19 checkpoints. And for the tribes, this is the public health measure, because the tribes have so few resources to deal with this. And so they can't have all these people coming through spreading the virus. And the checkpoints are really not that invasive. And so yeah, that should blow up again if Trump does take action in the national news. So, and
that's true. I mean, I've read that the data on the reservation has pretty much been left out of federal data collection, which itself, as you've noted, becomes a challenge when you're thinking about addressing the severity of cases that exist. If you don't have accurate numbers, then how can you respond appropriately? And because of that, federal aid is almost non-existent on some Native communities, leaving many to resort to GoFundMe campaigns.
Well, there has been $8 billion that the federal government has already allocated, and there's another $20 billion, I think, in the works. But it's but they haven't had access to all of it, and it's been very slow. They've had to wait much longer than cities and states have had to wait to get the funding. I think the cities and states and counties got their funding within the first 30 days, and many of the tribes are still waiting. And then about 40% of that $8 billion has been basically sort of frozen because of a lawsuit that some of the tribes have brought against the federal government. And in fact, the federal government had no mechanism to even disperse the money for a very long time.
I know one, and I'm going to bring in a couple of others into this, but one of the feedback I received from community members that I know in the Dakotas is that a lot of their vital businesses have been closed, that the community members are not gaining access or receiving the resources, and that they're having to resort to their own GoFundMe campaigns in order to survive. And so I definitely want us to address that as well. I want to bring in Pastor Raz, who is in Brazil. Recently, I read the article, most recent reports from Brazil president, that undermines the severity of this virus. In his words, describing it as it's just a little flu, reminding me a lot of the response of our president here in the US mentality towards this pandemic. And again, centering on James Baldwin's reflection of solidarity. Do you feel as if the message of those citizens in Brazil is being heard beyond its borders, and that because of the position of its president, that is the rest of the world taking seriously the impact of this virus in your communities?
Enfim, boa tarde a todos e todas.
Good afternoon, everybody.
O Brasil, assim como os Estados Unidos, demorou muito a perceber e a se organizar contra o coronavírus.
Brazil, as America, take a long time to perceive and take initiatives against COVID.
E o mais que o brasileiro hoje enfrenta é a tentativa do presidente Bolsonaro em não levar em consideração os altos números das mortes que estão acontecendo no Brasil.
And the big challenge for the Brazilians nowadays is not just the disease, but the way that the president is facing this problem, not in taking care and not paying attention in the big numbers of infected and people in death.
Para vocês terem uma ideia, o presidente não utiliza máscara, ele mobiliza as pessoas para que as pessoas vão para as ruas fazer manifestação.
So just for you to have an idea, the president is avoiding using masks all the time. He's speaking with people outside. He's encouraging people to make and prepare parades in the streets. So it's been very hard for the people to accept that.
E ainda hoje nós não temos nenhum posicionamento em relação à política de saúde de enfrentamento ao Covid. Tivemos 2 ministros que saíram e até hoje não foi apresentado um plano de ação do Estado.
And until the recent days, Brazil does not have a plan, a strategic plan to address the COVID. In less than 1 month, we had 2 Ministry of Health. Now we don't have any. We are in transition process. So the situation is that we don't have a plan as a country to combat the COVID.
E o grande desafio para nós brasileiros hoje é contar com o apoio dos estados e dos municípios que estão buscando construir uma política diferente da que é apresentada pelo governo federal.
The thing that are driving us to try to solve the situation is the alliances that are being made between the city governors and the state governors in order to create ways to confront this federal position in ways to solve the situation in the country.
Thank you for that. And I think it's really interesting when we look at the numbers in Brazil, the percentage per capita is quite comparable to the numbers in the US, where it's only about 6% and globally the deaths that are attributed here is 6.5 in Brazil, with over nearly 300,000 infected, just shy of, or just a little more than 19,000 deaths. In the US, nearly 100,000 deaths and over 1 million infected. And so I think the parallel in terms of the response, reaction to national leaders may say a lot. I want to go to Omar, Haramy in Palestine and speak to some of the systemic and systematic challenges that you faced in your location even prior to COVID, and how this pandemic impacts you in ways while the numbers for Palestine, and again, it could be quite comparable to what Jacqueline shared, may not be accurately reported. But I'd like to get a sense from you of if the numbers that we have for Palestine, if they're accurate, but also what are some other implications that you're facing outside of infection and death. The global numbers that they have reported for Palestine shows 398 infected and 2 deaths. And I'd love to hear your response on that.
Thank you, Reverend Maltrina. To begin with, we've been living for over 73 years in conflict since 1948, since Nakba, and we've been living for over 53 years under military occupation. So life has been very difficult because our daily life is very much mandated and controlled by 18-year-old soldiers, 19-year-old soldiers who make rules and regulations, and we have no option but to follow or get shot or get arrested if we're lucky. The numbers are not accurate for two reasons. One is a political reason, because it's when they they do not recognize our land as it's our land. So they divide our population, and they say these people are. So for example, numbers who are in East Jerusalem, they do not count them with Palestinians, because they say this is part of Israel, and because of the annexation that was also approved and blessed by the American government and your current administration. So even when there is also discrimination, when we don't have the right even, we have to fight to claim the numbers of our people. The numbers have been low, I think. There hasn't been big numbers, and I think there is an advantage, if it's ironically, living under military occupation. You understand that the regime that is controlling you and the establishment that is controlling you does not have the best of your interest on their plan. So communities learn to take care of themselves. Of course, this is only for a short period of time until people need food, or they've already spent the little savings that they have or the little food that is stored in their houses. So for the first 60 days from February, when we had the first cases discovered, people have really honestly, people have been taking care of themselves, of the community, because we don't have a healthcare system that would provide us. We are already deprived from our basic rules, so we had to take care of ourselves. But it reached a moment that people need to go, and we're just started now, people need to go and find work. The common debate is if we escape from COVID, how are we going to escape from hunger? And that's a bigger problem for people. People are hungry, literally. There's no food in many houses. There's no fridge. The basics for life do not exist. Of course, with the numbers also, there is also another truth to it. Statistics-wise, at least, we really don't know much about COVID-19. It's a new virus. Not everybody has statistics. Unfortunately, it affects the people who are already sick or are already on the margins. And in the developed world, you have some countries, if we call it the first world countries, you have a healthcare system that takes care of those people. Unfortunately, the life expectancy of people in third world countries, like my region, when you are diagnosed with cancer or serious heart problems, you do not survive for many years. So it's actually the disease that put you on the margins, on the high risk of COVID-19, have already claimed most of these lives. And this is, I think, is also very true to most countries.
I think it's really important to be able to look at the numbers and being able to be suspicious of those numbers in the case that, as you noted, as Jacqueline noted, when these numbers are not reported accurately and it does not take into consideration some of the other socio-political issues that have an impact on human life in your location. And so I think that that's really a critical point to raise. And we definitely want to come back more about the occupation and some of the systemic issues that had an impact on Palestine prior to COVID, and really flesh out more how that is heightened right now. But I want to, at this moment, go to Faith Tanui, who is in Nairobi, Kenya, to speak a little bit about some of the dynamics that they are facing there. But before I do, let me also thank Richard DeMay and Diana Ferreon for translating for us today. Appreciate the both of you for joining us on this town hall to assist us with translation. Faith, I would love to hear more because much like the numbers in Palestine, the numbers that are reported for Kenya are pretty low.
You're muted.
Thank you. I want to thank you for being with us today. And I'm not sure if you heard me when I thanked Richard and Diana for being here to assist us with translation. But I want to thank you in particular because the numbers for Nairobi, much like in Palestine, have been reported as being fairly low. And so I'm always suspicious of the numbers and want to give you an opportunity to reflect on what your take in terms of the impact of this pandemic in your region and your location. And in conversations we've had, you've shared other concerns that you've had outside of the virus that the virus itself has helped to bring to light. And I'd like to make space for you to share some of the concerns that you're facing right now.
Okay, thank you, Dr. Wolchina, for the opportunity to share my concerns and also to comment on the numbers. I'll start with the numbers from our region, more specifically East Africa. To the rest of the world, the numbers reported from the region might look untrue, and just like you said, you might be suspicious of the same. One of the reasons for that could be because of the inadequate testing that is happening across the region. Like for Kenya, with a population of 50 million, we've just tested slightly over 50,000 people since the first case was reported, which is over 2 months from today, back then. And we have over around 1,100 cases as of now. And that is very low, but compared with the numbers that we have tested, it's kind of comparative. And looking at the region, one of the countries that has actually done some good testing when it comes to numbers is Uganda. Uganda has tested over 100,000 people, but also their cases are quite low, but that is because of the measures that were put in place by the country. When the first case of COVID-19 was reported in Uganda, they went into some partial and to some extent total lockdown, and that has actually helped the country a lot. But the other countries in the region like Tanzania stopped giving us the numbers, so that's why the numbers are low and some people cannot even access testing materials. There is a case of a country in the region that people are saying that testing materials are only kept for the few, the government officials. So you end up having figures like South Sudan. South Sudan recently had someone from one of the government officials tested positive. And people had claims that the testing kits are not being used on local persons and just being used on some specific people. So apart from the fact that we lack testing facilities, also people are not going to openly come out and go to hospitals to be tested, because one thing, we are, until recently in Kenya, we were paying for our own quarantine cost. And that is like $20 per day. And you have to stay there for the required 14 days. And for a country whereby over 60% of the population is surviving on very low income, it is very hard. So we will never know, but maybe we have people sick in their houses, but people will not openly come out to be tested, because once you're confirmed that you're sick, the cost is even more expensive. And universal, like when you compare here with some Western countries, the Western countries have reliable health insurances, but for Kenya and the countries in the region, one concern that you will look into first is looking for food. Health insurance will come second, third, or something, because you have to look for we're talking about a very young population, that over 80% of the young people, over 80% of the population in the region consists of young people, and over 60% are unemployed. So these are population that is depending on from hand to mouth, and that's talking about a situation coming in at right now. It has created a lot of disparities, because these are people who are depending on manual labor and the short-term labors. But since some of the measures were put in place to try and curb the spread of the disease, it's been hard. because now, like for the country, for Kenya, we have the curfew, which we just supposed to be outside from 5 a.m. to 7 p.m. And then one of our neighbors, actually Sudan, they are only allowed around 5 hours, from 6 to 1. I think the measures have been reduced due to Ramadan, which is celebrated in the region, but that has been the case. And so most of our young people end up just staying at home because you cannot get to do what you usually do during those few hours. So a lot of businesses have shut down, and a lot of people cannot afford even to live in, because we have a very large population staying in Nairobi, for example. We have over 4.5 million people staying in Nairobi. And of that 4.5 million, 2.5 stay in slums. I think, Dr. Waltina, if you remember, when you were in the country, we went to Kibera, one of the largest slums in the country. And in that slum, we have around 500 people staying there. Now imagine that population in that small square kilometers, and everyone is stuck in that place. So it's becoming hard for people around the area, and we don't know. And today the press statement from the health officials indicated that we might be having more cases come September. So when you tell someone that we're still looking into having more cases reported in the future, it's confusing, because we've been indoors for 2 months now and the cases are rising.
Right.
And 2 months it's becoming just confusing and difficult.
Yeah, and I could only imagine, just in general, just the impact psychologically, emotionally, and obviously, as you've noted, financially, to be confined, to be restricted. And to hear you say that hunger, food, and then healthcare, and of course employment, kind of outlines the urgency for your community. It makes me pivot to Professor Mousin regarding those that are directly impacted at the border. And if you could share a little more about how these communities are impacted when they don't even have the option at all for mobility. And I think it's really interesting that in this country, in the US, they recognize some members of the immigration community as being essential, but illegal. And so I'd like to really kind of bring our audience and viewers into the world of those that are detained right now at the borders. We've already heard the horrific stories of communities that are children that are put in cages, families that are being separated, having limited access to healthcare and resources that they needed. This was before COVID-19. And we just heard Faith talk about food, healthcare, and employment. What are some of the ranking issues that are impacting those that are being impacted at the borders right now?
We have to remember that the world community put in a refugee program after the Holocaust and the tragedies of World War II. We as a world community felt that one of the lessons we learned were that when people tried to leave horror and other liberal democracies wouldn't let them enter, that caused more pain, suffering, and death. And so one of the crowning achievements after World War II was the Refugee Convention, which most of the nations of the world said, we will allow people fleeing violence, fleeing persecution, to come into a country and apply for asylum. And we've been working with that system in the world. In 1950, the United States enacted the Refugee Act in 1980. This administration has turned that upside down. So people fleeing the violence from all over the world, coming to the Mexican-American border, all of a sudden we're told, through what was called the Migrant Protection Protocols, that they could not apply for asylum and they'd have to wait in Mexico. So we had a process that's been going on for a number of years, not working perfectly by any means, but many people, if they get a chance to apply for asylum, if they get a pro bono attorney, they can tell their story of violence and they can go through the process. And this administration says, no, you can't. So now you have a border between a relatively affluent nation, the United States, and Mexico that already has issues, and 50,000 people in 2019 were not allowed to make this processing. So all of a sudden Mexico had to adapt, the border had to adapt, and now we have humanitarian crisis at the border. So that's one group of people. and they have lack access to healthcare. They have access to food. They're sleeping in tents and streets. And you have the problem of the cartels and gang violence. And therefore you have a whole nother group of people that can't access healthcare. So imagine what that does when a disease like the COVID virus hits. Where do they go? And how do they get protection? So we, the United States, have exacerbated the problem and created that much more healthcare concerns in Mexico. We've also then begun deporting people without process, as I mentioned earlier, taking people who've been in detention and flying them back to countries. Many of these people are infected with the virus. We are exporting the virus to Guatemala, Honduras, and some of the countries of Central America. Imagine that. We've already, through our violence, fueled some of the wars of the 1980s and 90s, and therefore weakened those countries. And now we're deporting people back with the virus, creating the problem there that's going to start the cycle again. People are going to flee, and we're making the problem all over again instead of taking public health considerations and dealing with this as a multinational event. The other problem, as you said, is we have a very aggressive enforcement through the Immigration Customs Enforcement, so-called ICE, that the communities in the United States are fearful that ICE comes in looking for the undocumented, looking for people, and putting them in detention. So the ripple effect of the enforcement, people don't want to go to the police, people don't want to go to hospitals, people are afraid. So this enhanced enforcement in the midst of a medical crisis makes our communities that much more fearful of accessing the limited care that might even be there. So this administration, it's failed in its attempt to build a physical wall. And so through its policies and directives, has tried to create a wall of policy that all it does is make the problem worse. And as you mentioned, we depend so much in this nation on the hard work of so many individuals. Some of them are the undocumented, and we've called them essential to get food on our tables and the folks that are taking care of people in nursing homes or private care in homes. Many of them are either immigrants or undocumented. And we're now, that enforcement making people fearful, and it just breaks a broken system even worse.
You know, I appreciate you even highlighting like the culture of violence that surrounds the tactics of ICE and the implications it have on those that are detained or those that are seeking refugee or support on these shores. And it's interesting when we think of the borders, the walls here. I always think of the borders and the walls in Palestine. And I also think of the culture of violence of this country and the impact that it have on other nations. And so hearing you make that direct connection with some of the political positions of this country and the impact that it have on those that seek asylum here. I'm thinking about the recent political mandates by this administration on Israel and Palestine. And Omar, I would love to hear your thoughts about the implications that it's having on Palestinians now. But then I also want to bring in back Jacqueline and Ross as well to speak about directly about the political state there and the safety and cause that many activists and organizers in your location are fighting for to address poverty and hunger as a direct result of COVID. But let's start with Omar. I'm in your microphone, Omar.
With COVID-19, it's one of the few times in history, or that I'm personally aware of, or at least in recent history, that the entire world attention is focused on one subject, on one topic. So when everybody's focusing in one area, it is I think out of kindness, everybody really neglected secondary concerns or other concerns that have been really affecting us. And that was a stupid point, at least here in Palestine. So we've neglected and we've ignored the human rights violations of the Israeli military. We've ignored all of our traditional problems, and we all focused on the COVID-19. And in the beginning, there was this nice, cozy feeling that all planet Earth is healing. We're all working together to fight one common enemy, which is the disease. And I think I was one of those people, and I think I was stupid, honestly. Because if you continued looking at the news, human rights violations have continued with no stop, as if this machine, the government machine, the policy, had a plan, and nothing was going to change this plan. Regardless, COVID was happening or not. The only thing is when the army was breaking into houses next to my house and so on, they were wearing masks. That was the only difference that we have encountered. I think we also have, in one way or another, we have also failed to prioritize, as most of the people in the world, we're good people. People are in general good people, regardless of color, ethnicity, religion, background. In general, we're all simple people. And most of the people really started caring about their family and their direct concerns. And there wasn't really big groups who was doing lots of leverage on the decision-making when the governments were doing it. We were all felt we trusted the health ministry, or most of us, or regardless the regulations of the specialists and the scientists and the people who are experts on the field. While actually there were strong lobby groups that were really concerned. You had the business groups, the people who were trying to keep the business, and some of them it was very profitable, this coronavirus situation. You've had people who were really pushing, disregarded human safety and focused, especially in the developed world, or in Europe and North America especially. They tried to deny that COVID existed, so that in hopes that they would keep the economy working, so that they keep the money being generated. It's the poor have always been poor. The people who are living on minimum wage, we've always been living on minimum wage. We've always been suffering. It's the people who were making the millions and the billions of dollars who nothing could even stop their greed of collecting all of these finances. And again, we became as consumers. And the moment that we have also, and when the numbers went up, but we also lost our purchasing power, they wanted to bring us back to the market so that we work regardless of our health, and let's go back and contribute to the economy. An economy that is already making less than 1% of the world, control 99% of the world wealth. So we have, and that's a lesson for us. We should not neglect or prioritize our main concerns, and never we should stop working for our human rights and for our liberation. Because I tell you, it's the structures of power that we are facing are very greedy, and they are determined not to change their course. They refuse to repent. They are refusing to repent. And we are refusing to really take care of ourselves. So I mean, I'm really happy and excited that we are coming together from different continents, from different backgrounds. And what brings us all together is that we are the numbers. Not only the numbers that who are really being affected by the COVID or by poverty or by all forms of universal problems, we are also the numbers. We are the people who inhabit this planet. We are the majority, and in democratic systems that respects human rights, we are the ones who should really determine what is better for all of us, not only for a bunch of greedy individuals or the people who really benefit from a structure and leave us all on the margins, just to die and be buried as numbers.
Right, and when I hear you speak, I'm thinking of Lila Watson, an Aboriginal activist, who said, if you've come here to help me, you're wasting your time. but if you've come because your liberation is bound with mine, then let us work together. And your words remind us that, that this is a collective work and responsibility. And it is critical for us to not just look at ourselves as these small minority groups in this location or in that location, but to look at the power as a whole. When we come together collectively, the power of our voices, and the importance of us working together, which, you know, our opening quote from Baldwin was in his letter to Angela Davis. And Angela Davis speaks often about the importance of, particularly to Blacks in the struggle in the US, to be mindful of the struggles in the diaspora. And she specifically speaks about Palestine. She specifically speaks of South Africa. She specifically speaks of Brazil. So just that level of consciousness that what we are looking at in terms of militarism, state-sanctioned violence, poverty, and the like, is not isolated to Chicago. It's not isolated to Black and brown bodies in America, but these are challenges that we see communities experiencing around the world. Roz and Jacqueline, working directly with activism and outreach in your communities. And I also want to make sure that folks are paying attention to the comments that's being posted by our moderators, where we'll provide link to the different organizations that our speakers are associated with, so that you can find out ways that you can become engaged and to support their work around the world, and to educate and inform ourselves more about the ways that this virus and poverty and racism is impacting these communities respectively. Jacqueline, why don't you share a little more about some of the organizing work that, that you see or that you're a part of in Native communities, and ways that folks can become involved and to raise their level of awareness around how COVID is impacting these communities. And your microphone is muted.
Yeah, so I'm actually a journalist, and Pollination Magazine is a collective effort by Native American women journalists, and we are working to elevate the voices of Native people and perspectives, because often stories told even from, you know, people who are well-meaning often perpetuate stereotypes about Native people, as you can see with the CNN and MSNBC reporting, you know, where Navajos, the headlines basically come out saying that Native people are dirty, that they're germ-ridden, and we've seen backlash from that kind of reporting, where you know, a border town, we have these border towns of white towns along the reservation borders, and they are very racist. And so they hear this kind of reporting, and they don't actually even read the article; they just see the headline, and then they just one guy actually was doing a call out on Facebook to kill all Navajos, a white guy, because we were 100% infected with COVID-19. And so we really seek to really address these things in detail. We're a magazine, not a newspaper. So we do really in-depth reporting, and our podcasts, Indigenous-centered conversations around coronavirus, which we do 3 times a week because there is such a gap in knowledge and information, really allow our guests to really speak to these issues in a lot of depth, and Native people from across the country. So I think as far as what we see going on, we see this tremendous effort going on to help. I think this really speaks to our traditional Indigenous ideas of community and how we support each other. The Navajo Nation is the largest Native tribe in the United States. It has 360,000 members, of which about half of which live on the reservation. And we've actually tested, I just looked at the latest update, they've tested about over 27,000 folks who live on the reservation, and that's about 15% of the population. So, and this is non-natives also live on the Navajo Nation, and members of other tribal members, several thousand. So it's, but yeah, I would say that the issue is often related on sovereignty. I think the thing that I would like people to know if they want to help Native people is to understand who we are politically, because our sovereignty is deeply tied to our rights to the land and our rights to exist politically. Our political existence precedes that of the United States. Some of the first treaties that the US entered into were with Native nations. we were I think the Cherokee Nation was the first one, and they were the first international in the international body to recognize the United States politically. So we actually are, so when we treaty with the United States, these treaties fall under international law. Treaties can only be entered into by sovereign nations. These are not like, we are internal, but we are not internal. So a lot of the fights going on we see with COVID-19 and the pandemic is the way in which Native nations are taking a much stronger role in controlling the pandemic, the communities, and they're being actually, Trump is taking this opportunity to try to terminate tribes. There's this whole effort going on, even during the pandemic, to basically make tribes politically disappear. And so with the Trump administration, we've seen this, and they just, right now they were just in court trying to basically de-recognize the Wampanoag, who were like the first Native people to meet the Pilgrims at Plymouth Rock, right? Trying to take their land out of trust, trying to make them disappear politically as an entity. And so, and of course, with the governor in South Dakota, Governor Noem, her attacks on the COVID-19 checkpoints, she just recently, I think today, sent a letter to President Trump, asking him to come out and basically, physically take down those COVID-19 checkpoints and basically disregard tribal sovereignty. So I think understanding who we are politically, understanding our situation is really important to actually working with us. I think, it's often what's lost in the advocacy work that happens. And we are sovereign nations within the United States. And of course, that relationship is unequal, right? But the United States really depends on trying to make us politically disappear because of our claims to the land base. Most of the land in the United States, the land claims of the United States is held purely through military power. And that's what we saw at Standing Rock. You saw that military occupation of Indian land made visible, right? So you saw the guns, you saw the armored, you saw everything. This is how they keep our land. Right. That area is within the Treaty of 1868, and that is legally still part of the Great Sioux Nation. So the whole area going up to Bismarck, north of Standing Rock. And so that is all land that they are illegally occupying in defiance of international law and actually in violation of the Constitution of the United States, because the Constitution of the United States says that treaties are the supreme law of the land. So when Native people and Native communities and Native nations do things, there's always this context to it.
Right. And I invite our viewers to go to pollinnationmagazine.com. Are there any other links that we should post for our audience so that they could be informed, Jacqueline, that you'd like to share?
Yeah, I guess other things that we really look at are other Native publications. Certainly we have, Indians.com, Indian Country Today, and there are a lot of really great efforts, community efforts being made out there. And, but yeah, I think, reading the news from the Native perspective is really important because it's something that is missing, and the framing, I often call like white privilege and white supremacy, it's like the house that you were born into. And to a certain extent, people who live in that house, they can't see the world. They think it is the world, right? And it frames their view of everything. And so even when they're trying to help us, it does become very, they're very limited in how they can actually do it because of this bubble they live in. So I would definitely say, we all have those perspectives. We all are all limited in that way, and so actually reading each other's work, reading each other's really helps to basically help us understand each other better.
That's great. Thank you so much, Jacqueline, and for the work that you're doing. Craig, I believe you may have to leave, so I wanted to make sure before we go to Pastor Ross that if there are resources that you would like to lift up that can help people to be conscious of what's happening at the border and understand how our immigration communities are being impacted. There are a couple of questions that I believe may be appropriate for you. But as I pull up those questions, I wanted to ask if there are some resources that we could post and share with our audience. And don't forget your mic is muted.
I did post two, one involving how the United States government's been dismantling the asylum and refugee process over the last 3 years, the timeline of how they keep, as I said earlier, they failed to build a physical wall, but they've now made a wall of policy and executive orders that has kept a lot of people out, and that's important to see. I think what I'm so pleased that all of the speakers that, first, I don't have to leave. I've changed my plans so I can be here. But our violence in Central America has often been aimed at the indigenous populations of Central America, and the wars that were fought in the 80s and 90s are going back to the coup in 1954 in Guatemala that was instigated by the United States government, is often aimed at the indigenous populations there. And much of that violence has led to people fleeing those countries to be refugees in this country. And we have mass incarceration in this country. We have immigration detention with 30 to 50,000 people detained every night, many of them in private for-profit prisons. And sometimes we forget that it's the people making money off of these prisons that want these systems to continue. And we have this really terrible problem in the United States of thinking we can just lock people up and that solves a problem. And yet with COVID, we're finding that one of the hot spots are detention, whether it's criminal prisons or immigration detention. And again, as your opening quote, it affects all of us, guards, people who are trying to make a living in those facilities, and the detainees are coming down with these diseases. And we forget that all of us are involved in how we do this. And these policies of detention and deportation are just made worse with the COVID crisis.
One of the questions, thank you so much, Craig. One of the questions regarding immigration that was lifted by our audience is about access to medical care. And for those persons that are being detained, can you speak to how the U.S. government is providing medical care and assistance to those that are being held by ICE, if at all?
Well, again, what's interesting about this nation is we have 50 states plus the federal government. And so you see states like Illinois and California saying, we will help protect the undocumented and the documented. This public health crisis doesn't recognize legal papers, doesn't recognize walls, and so we want you to come. The problem is, there was a story in NPR this morning, one of the reasons why the Latinx community has a higher rate of positive cases is the fear. One, they're living in many situations in the south side of Chicago in more cramped quarters. But more important, the fear. You're able to go to an emergency room, but if you've seen stories of ICE stopping ambulances in the past, or ICE going into hospitals, or ICE getting records of people, you don't want to put your family at risk. And what it makes us so dangerous that you might be documented, but there might be an undocumented person living in your home. And you go to the hospital and somehow someone's checking things, there's a fear that perhaps that will be linked back to the people living in your home. So this all gets tied together. And we need to, your whole purpose of this town hall of how I am because of who you are is really highlighted that if we don't care for one another, it's going to make the situation worse.
Amen to that. Pastor Oz, I'd like to bring you back into the conversation, and I want to thank everyone for being with us today. I want to thank all of our speakers for the powerful insight that you bring from your respective location. And this is just really critical that we have this dialogue just to remind us that we're not in this small vacuum, that we are connected. I have read reports about some of the challenges that are taking place in Brazil in the favelas, the violence against citizens that are trying to have access to aid. I'd like to just hear a little more about what you are witnessing and experiencing amidst those that are impoverished, that are struggling in the favelas, and what can we do to help raise awareness around those challenges? Pastor Oz.
Como está acontecendo o enfrentamento das pessoas nas favelas, né? Como está sendo o tratamento, as questões de pobreza frente ao governo brasileiro nas questões do Covid-19.
Bom, a gente, como eu disse anteriormente, o Estado brasileiro apenas, a única ação do Estado tem sido uma ajuda emergencial que está em torno de R$600, equivalente a $127.
The only federal support that has been given to the poor population is emergency help, which is around R$600. It's around $120. This is the only initiative in terms of help for people in favela and poor communities.
E parte dessas pessoas que estão recebendo esse dinheiro estão sendo submetidas aí ao banco, e no banco essas pessoas estão sendo ficando em aglomerações, ou seja, um recurso que era para ser dado para ajudar está sendo também um recurso que pode viabilizar a contaminação de pessoas.
These people need to go to the bank to access their account, and because of that, because of the big number of the people who are being helped with this support, there are big agglomeration inside the banks and outside the banks. So this is it's become a huge problem because the dissemination, the spread of the COVID is really possible with this big number of people together to get the resource for the bank.
O que está acontecendo de forma desconectada ao governo é a mobilização de organizações e movimentos, juntamente com igrejas e outras associações religiosas, que estão se mobilizando e viabilizando coisas como botijão de gás, algum tipo de remédio, comida, mas não temos uma assistência do Estado que contempla todo mundo.
Despite of the fact that from the government, the people are not receiving so many support and help, there are a parallel movement organized by churches or human rights organizations, helping people with food, with health materials, even with gas, to help them to survive in this difficult situation of COVID.
E ponto importante para se destacar é que se a ajuda emergencial chegou a R$600, equivalente a R$127, foi uma luta organizada por vários setores, tanto dos campos de esquerda e de direita da Câmara Federal, que conseguiram aumentar o valor da ajuda, porque a ajuda estava em torno de R$200, que eu acredito que seja uns $50, por aí.
And it is also important to highlight that in the beginning, the support was suggested by the president for an amount less than $50. And after a big debate caused by parties from the right and lefty sides, it was possible to push the government to increase this amount to $600, equivalent to $120. So it was also a big debate because it was not the first initiative of the government to give it the right and an amount accessible for the people in population.
A grande verdade é que o governo brasileiro, em especial o governo federal, não estabeleceu nenhum tipo de uma organização capaz de ajudar os estados e municípios. Na verdade, o governo federal está estabelecendo conflito político, disputa política nesse momento de coronavírus. E, com isso, os municípios e os estados estão tirando o que não tem para poder chegar mais próximo, uma ajuda mais próximo aos estados, aos moradores, à população como um todo.
The big issue is that the federal government didn't establish a platform or organized plan to support the states and the city. The big thing is that the governors and city are providing the support by themselves, and they are now in a big conflict with the government, with the federal government. But this is the only way that the people can be supported and be helped in this kind of situation. So the conflict among the governors has been a very big debate for us now.
E é importante também dizer que muitas igrejas estão celebrando seus cultos ao vivo, de portas abertas, e que isso também tem sido um fator que não ajuda exatamente a população. Então, a gente tem hoje o problema do Estado, que não consegue dar conta na população, não consegue chegar na população, e temos também muitas igrejas que não estão buscando assistência, mas estão fazendo cultos para arrecadar oferta e permanecerem com seus espaços sustentados por conta dos espaços serem de aluguel.
So another big debate is that the president declared that services, open churches is a priority. So there are a lot of churches being opened, receiving people to services because the majority of the temples are rented. So they needed to raise money to support the services in the maintenance of the church. And this has become a very big debate because people are in churches without any protections, agglomerating, and this is another way to spread the virus and promote increasing of the numbers of infected.
E para concluir, muitas dessas igrejas, elas não estão conseguindo dar uma assistência material de alimento, de remédios, materiais de proteção. E aí as igrejas históricas, em sua maioria, que não estão celebrando de portas abertas, mas celebrando online, estão sendo aquelas que estão mobilizando pessoas para arrecadação de alimentos, para poder ajudar as comunidades.
The thing is that the majority of these churches does not have the conditions to support the poor communities with food, with healthy equipment, or anything to avoid the spread of the disease. But it's also the traditional churches, the historical churches who are not open their temples, but who are doing online services. That are the churches who are being united with movements and with communities in order to support the people who are in disadvantage and the people who are in very difficult conditions because of the virus.
Thank you. And you know, that's interesting that you, Pastor Ross, thank you for bringing up the church. I mean, that's one of the major concerns even here about, are the churches opening too soon? And the places or the entities that are being invited to open, like the hair salons, the congregations and places that would definitely have an impact on communities of color, that they are being invited to open, some argue too soon, and looking at the risk of infection, increasing infection, or as we're seeing supposedly numbers going down, that the numbers will now go back up. And so what is the role of the church? What are the ways to reimagine the church right now so that it can, one, be safe and protect its congregants, but also at the same time be a resource of support for the communities? Faith, are you able to speak to what are the challenges for the members in your community in terms of engaging their faith spaces? And one of the questions from our audience is also talking about the mental health condition of those that are being impacted. Can you speak to the spiritual and also perhaps the mental impact of this virus in Nairobi and beyond.
Thank you, Dr. Walshina. I'll start with the issue that you've raised about the church impact and how people are going about it. When the different measures were put in place by the government, it meant that stopping all gatherings across board, even churches. But as of today, the church councils in the country have been trying to get permission so that they can start services. They're arguing out that in Kenya, we opened, the government went ahead and decided to open restaurants and bars, whereby people have been allowed to go to the bar and just maintain the given regulations. So why are churches not being allowed to open and continue the same regulations? So by the end of the day today, the Ministry of Internal Affairs has given the church not so a green light, but to go back and rethink on how they are going to ensure that the measures are taken care of. I think this is mainly because the country church people, when the measures were first put in place, many people still went to church and didn't observe the social distancing issue. But if the measures are put in place well, maybe church attendance can go on, because compared to the West, whereby you can still conduct a church service online, here it is not possible because most of the people have no access to internet and have no access to social media platforms whereby you can have a live service. So to us here, physical church is one key there, but we shall see in the coming weeks if they are going to open that up. And then you've talked about mental health. Maybe something that you will find surprisingly somehow, when you talk about mental health in a Black home in Kenya, people will tell you, no, we don't recognize that. One thing, people have somehow been forced into situations whereby they've had to harden up in such a way that when someone decides to talk about their mental health and all they need help, being listened to is a thing that will take a while. But things have been improving over time. But with COVID here, one group that is facing a lot of issues currently of mental issues has to be the youth, who are also affected daily by this. These are a group of people who don't have employments, who don't have houses to stay in. And then before COVID, it was easy for people to stay away from the people who are affecting their mental health. But right now, maybe that person who is causing issues is a family member and you're stuck in the same household with them. We have some online platforms that provide free services for counseling for such cases, but that's not a widespread message. It's something that we still have a long way to go to as a country, because just like I started by saying, when you talk about mental health here, it's quite a challenge. People still view it as a foreign thing. It's not like it's there. It's very hard to explain to an old African parent that you have issues. They'll tell you, we went through more. What do you mean you have issues? But yeah.
I would think that you would find that the tabooism attached to mental health is certainly something that many communities can identify with. It's still very taboo here with people being able to receive help. But maybe if it's in the framework of trauma, how are you responding to the trauma of this pandemic and the trauma of not being able to go out, or the trauma of being restricted in many ways? Perhaps that's a way to be able to shift the conversation. I shared on our very first town hall, we talked about health disparities. And I quoted one of my professors from seminary who spoke of protracted stress disorder, to recognize that the trauma is still very real, still very present. And so when we think about some of the disparities or challenges that persons in occupied Palestine may face, or challenges that someone in the favelas with militarized presence in the favelas in Brazil and the challenges that you faced on the Native reservation in the US, what the trauma that pre-existed prior to COVID, how is that heightened now that we have these restrictions and these challenges? The trauma, Mr. Mousin, of taking this journey to seek support, to seek refuge, and to be separated from family, to be put in cages, to not have access to the healthcare or resources that you sought. What is the trauma that comes from that? And so I think that again speaks to the shared narrative of struggle that we could perhaps all identify with in our respective locations. And also, Faith, one question for you came up about, someone said that there were some provisions that were given in Kenya, food provisions, but there were concerns that that is no longer in place. Can you speak briefly to if there are resources that are being provided, and then what are the risks that people take in trying to gain access to those provisions given the restrictions that are in place for travel?
Okay, I'll talk about food provisions from two levels. I think the first one is whereby the government has been trying to provide some cash transfers to some individuals as we try to cope up with this. One challenge that has been there is the fact that people are complaining that the money is going to the wrong hands, because some of the money that is being used in this cash transfer program is money we received from World Bank as a loan and some other institutions that are funding the COVID economy situation in the country. So because we've had cases whereby someone talks, we had the chief in the country, we have the administration goes to the ground level where we have the chiefs, whereby they were registering people for these programs, and somehow you had to know the chief to be registered for the program. So you find a vulnerable person not being on the list, and also it only happened for people only receive money for a week. The current I don't know if we have continuity of the same, because less people are reporting on the same. But the country will be going to a general election in 2 years from now, and politicians are using this time to their best. They are the people who are distributing a lot of food supplies across the place. I think almost each and every politician is doing some food drive somewhere, whereby they just do some small shopping and then they put in a bag and then they're distributed in open places. The challenge with that is whereby in some cases social distancing is not observed at all. Like we've had a case today, there was some food distribution in an area within the country, whereby the food distribution exercise is happening in a place where in a police station, but still no one is observing any of the regulations given. But you cannot blame the people who are receiving the food supplies, because these are people who have gone days without meals. These are people who just need that one meal to survive the next maybe 3 or 4 days. So we have a lot of people are going through a lot, and because of the different regulations that have been put in place, we have some specific towns within Nairobi and one other major town, Mombasa, which have been completely locked down, whereby they cannot leave the area. So for someone who is staying there and works outside, it means they cannot leave anymore, which means that their source of income is done or something like that. We've had people who landlords have had to chase out of their houses because they cannot afford to pay rent anymore. So apart from issues that we had in the past, which include the country really report cases of gender-based violence, but right now the cases are rising because the people affected by the violence cannot move from their houses now because of the situation. We are supposed to stay indoors, but you're staying indoors with your abuser, which gets worse. Like for April, we had a very high number of reported cases, and we don't know if this goes on like this. A lot of issues that were not big of a deal in the past will continue coming up. Another issue that I've also seen, these have not been reported in Kenya, but in the neighboring countries. In the past, we've been trying to eradicate some of the common issues like polio, some children vaccines, but those things, since COVID started, those things have not been taken care of. Like DRC, they have stopped some of the vaccinations, which are like essential for life to continue. And also, like in Kenya, and some other regions, some of the treatments had to stop so that we can focus on COVID. Cancer treatments somehow had to stop. People can't leave their houses, and people cannot access medicine like how you can order your medicine online. It's kind of still hard in this region. So even apart from right now, post-COVID will be another issue for the area. And maybe to talk about the money that is being used, that someone said it was then, and it's not there anymore. Actually, we have a challenge right now. The World Bank is sending money to the country to curb the spread of the disease. But then the World Bank sends money, and then 24 hours or less later, we have breaking news of money being stashed abroad by different officials of the country. And this is aid money coming to the country. That's something that poses the question, I don't know, do we really deserve this, or are we doing something wrong, or just a lot of questions?
Well, no, you do not deserve to be marginalized or exploited or mistreated. And a part of our hope with this conversation is for us to be able to, even for me as a citizen in the US, to be able to critique our own country in terms of how it is a participant in causing harm to other nations, that some of the challenges that African nations are experiencing right now, you mentioned the World Bank, et cetera, didn't just start with this virus. That what are some of the systemic ways that this country has played a part in exploiting resources and causing harm and marginalization to nations abroad. And I want to come back if we have time, but I want to make sure that I circle back to everyone to get a final word in before we close. But one thing, I read an article recently about the success of African countries that are often being overlooked in terms of how it's responding to coronavirus. So for example, I think in Senegal, there's a development of a testing kit, according to the Guardian magazine, that costs $1 per patient, and that they can receive results within 10 minutes, and to be able to raise awareness around infection, and just also the success of being able to keep some of the numbers low. But we have not been able to, in mainstream media, be able to receive information on successes. And so even when we talked earlier about stereotypes and stigma, how those very stereotypes and stigma regarding African nations can prevent us from being able to glean and learn from these communities to help us to be able to resolve a pandemic. So I'd like to close out with your thoughts on that. But I want to go to Jacqueline really quick because there are some questions specifically asking if there are some recommended nonprofits that you would suggest to help provide food and support Native American communities that persons can be conscious of.
Yeah, well, as a journalist, I'm a little uncomfortable promoting any particular entity. I think we saw a lot of corruption in Standing Rock, and we're still investigating all that 3 years later. And but you know, we've had on our show, on our podcast, we've had Ethel Brandt. She's the former Attorney General of the Navajo Nation, and she is running a really successful GoFundMe. They've raised about $4 million so far, and it's totally grassroots, totally, you know, they're coordinating with Navajo folks from all parts of the reservation in 3 states. The Navajo Nation extends through Utah, Arizona, and New Mexico. And from what I can tell, I have confidence in. I mean, obviously we won't know 2 years later, but and there are many other groups. The Navajo Nation itself is raising funds. There are a number of organizations that are doing that. I'm not that familiar with all of them, so I can't speak to how credible they are, and I can't really, as a journalist, I can't endorse any of them particularly. I can let them, but we do, and if you can check out our podcast, we interview a lot of people. We just finished our 24th podcast about the coronavirus pandemic in Indian country. So we've done a lot of interviews, and And so there is, I'm just really proud of Native people to the extent to which they're really working hard to bring resources to the community. Like I mentioned about most Native people don't live on the reservation because we are economic refugees from the reservation. The reservations have been denied infrastructure, and this is a real concern. The Navajo Nation, many people don't have running water. My grandparents did not have running water until this century, until about 2010. My grandmother worked for 20 years to bring, she's a traditional Navajo woman who doesn't speak English, but she was politically very organized. And so she was able to bring water to our community, but not everyone has running water on the Navajo Nation, which makes it difficult. So I would say there's a lot of aspects to what we need. I really, really think that none of it is helpful unless you understand our political framework of who we are. And so it's, but the issue of structural infrastructure, certainly all communities of color in the United States suffer from lack of investment. And this is purposely done, obviously. I mean, so the lack of investment in any country, infrastructure, the way in which land is tied up, it's very hard to, it goes back to the doctrine of discovery. When we were, the US bases its legal claim to the land of the United States on this thing they call the doctrine of discovery, which means that only European Christian discovering nations can have fee simple title to the land. Once they landed here and they put their flag down, they basically, the title just automatically went to them. And as we are not European and we are not Christian mostly, we don't have legally under the US government's interpretation of law title to our own land. We have only the title that animals have of occupation and use. And this is a denial of our human rights. This is still the law of the land of the United States. As recently as 2005, Ruth Bader Ginsburg quoted it, cited this doctrine in the case of the city of Sherrill, New York versus the Oneida Nation of New York, and to deny the Oneida Nation's right to the land. So it's there's a lot of ways in which we have structural problems in America that are based directly on the colonial nature of our government. And I don't use the term settler colonialism because I don't think they really settle. I think it's a beast of consumption. And so I think that we need to, I think that after all this, we need to actually worldwide need to produce a pandemic-proof economy. And that means we're going to have to sit down and redraw what our economies look like, what our social support systems look like. And so I think that Native nations need to be at that table as nations, and that we need to be able to redraw our relationship with the United States that puts us at risk, that endangers the lives of our people. And so that's something that I definitely would like to see other allies take part in. And certainly it's something that we all, as you're citing Baldwin, we all are in this boat together. This is a system that is, the system of white supremacy and colonialism is a system that's endangering the world in this pandemic and generally speaking with climate change.
And we didn't even get to talk about climate change, but thank you for that. I'd like to close out with all of our speakers having an opportunity to be able to just share any last insight that you would like our community to hear and know as it pertains to our collective responsibility to be engaged in a global response to this pandemic. I'd like to start with Omar in the occupied state of Palestine, and then go on to our sister Faith in Nairobi, our brother Ross in Brazil. Craig, of course, I'd love to hear your reflections and thoughts, and then close out again with you, Jacqueline. So Omar, if you could share your reflections as we prepare to close out. And if we just keep it brief so we can hear from everyone.
With all of the challenges that we're facing and with how much extra pressure COVID has already brought to communities that are already suffering, I think there are opportunities and there's lessons learned. Only through collective, I mean, it's the virus, you fight it in one way, health officials say, is by being separate from each other. But also we can fight it by being together, mentally and ethically and on the same value system.
Thank you, Omar. And I just want to say personally that I remain in solidarity with the plight and struggle of the Palestinian people. And I do pray that, that the struggle is not forgotten. And as we think of borders and walls here in this country, that we will be mindful of the borders and walls that harm the historic narratives of communities all across this world, including in Palestine. So bless you in the struggle. And I pray for freedom and hope there. Faith?
Thank you, Dr. Wachina. Maybe apart from everything that we're going through, one thing, COVID-19 and any other virus that has this much global impact changes the course of what happens next. And as different countries are having recovery plans and post-COVID plans, for my country and maybe for other countries, we need to involve the people who will actually be in that future. This will affect 10, 15, 50 years to come. So we need to involve the youth in all the plans that we have in post. And right now, even as we deal with this COVID. If the measures put in place are only being conducted and dealt with by the old generation, when these happen again, we'll not be able to help at all. Yeah.
Mm. Thank you so much, Faith, for being with us. I know it's late there, so thank you for staying up to have this conversation. And my heart is also with the people of Kenya. Pastor Raz, we want to invite you to some final reflections with us as well.
Eu queria agradecer, né, a oportunidade de poder estar ouvindo e saber que todos nós estamos diante de uma luta muito grande, mas em Deus somos grandes e podemos vencer juntos.
Thank you for the opportunity to share my story, also to hear the stories of all of you. We are facing a very big problem, a very big situation, but in God, we are powerful, we are higher. Thank you.
Thank you. And I will never forget my opportunity to be with the Mothers of May in the favelas. And I just want to let you know that our spirit is with you in that continued struggle against state-sanctioned violence, and that you are not alone. So thank you for being with us today. Professor Mousin.
Thank you, Reverend Milton, and thank all of my panelists. You've been an inspiration to me. I'd like to conclude maybe with an inspirational story of I am because we are. Many of you know that President Obama issued an executive order that allowed the dreamers, those youth who were here without papers but grew up, they may have come across as babies or 5 or 6-year-olds, went to our schools, graduated from our high schools, and were at risk of deportation, deferred their deportation with the hopes that we'd be able to find lawful ways of making them have a path to citizenship. That has not happened yet. In fact, this current administration is trying to deport all of those. 800,000 people were able to get status and grow up in the community. Of those 800,000, almost 27,000 have graduated as doctors, nurses, or work in the medical and healthcare communities. Here's 27,000 people that our government is trying to deport right now, and we may get a decision from the Supreme Court in the next week or two that'll tell us what their status is going to be under American law. And yet, even though our government is actively trying to deport them, they are risking their lives by going into our emergency rooms, our hospitals, our healthcare places to help our community. I'm grateful for their dedication. I'm grateful for their sacrifice. I'm grateful for their inspiration and teaching me that I am because we are. Thank you.
Ashe, thank you for reminding us of those hidden figures that are on the front line supporting us in this moment that are considered illegal, but yet essential workers in our society. And I do pray that they will be able to prevail in their own personal efforts in seeking citizenship and recognition as such. So thank you for the work that you do and the way that you're mentoring and inspiring young lawyers to take on immigration and refugee law so that we can be on the side of justice in this country. Thank you.
Thank you. Thank you.
Yeah, thank you for inviting me. I really appreciate this time, and it's really great to hear the updates from around the world about how people, the communities are dealing with it. It sounds like we all really are in the same boat. And I guess just with the Indigenous perspective, you know, I think I give this lecture about how the U.S. is still a colony, and it's easy to define what a colonist is, you know, but it's more difficult to define what an Indigenous person is. And you know, I think that I really turned to sort of a definition that my grandmother's cousin came up with, Vine Deloria Jr., which was that, you know, we are people who we were made a people. And, you know, most of us call ourselves the people, like Dene, Navajo means the people. And because we became a people when we made an agreement with a manifestation of the land, a spiritual being who was a manifestation of the land itself. At that point, we became a people, and we had to live by the rules that we made in that agreement of that relationship, of that kinship to the land. And it's usually a specific area on earth. For the Navajo people, it's between the 4 sacred mountains and the 4 sacred rivers. And we are lucky that our reservation encompasses that area. And for my father's people in the Dakotas, you know, it is with the White Buffalo Calf Woman and with the Buffalo Nation and the Great Plains itself. And so I think that what Indigenous people, why our communities are so, the way, I'm really proud of the way our communities have responded, you know, with a real commitment to each other. You know, there has been a rise in domestic violence, that's true. But overall, there's this incredible, we're showing who we are, what we're made of, the stuff of what we are. And certainly the powers that be, Trump and his administration, are showing who they are. They're still, you know, he's basically gotten rid of the Environmental Protection Agency. You know, he's coming after tribes, trying to politically terminate them, all in the midst of this pandemic. And so I think that one of the things we can bring out of this pandemic is a greater knowledge of who we are, each of us. And that when it's time, and there will be a time where we're going to have to remake the society, because even the powers that be, you know this, because they're financially hurting as well. And we need to carry that with us when we go into those places. And we need to remember who we need to get to know each other as well. And so that's all. Thank you. Hagone.
That's so beautiful. And thank you so much for that. Thank you to all of our panelists, our translators for supporting us today, for the very profound and beautiful wisdom that you've shared with us, with a great urgency of now, for us to not forget our interconnectedness. And I invite everyone to visit communityrenewalsociety.org to learn more about the ways our organization is engaged in community in responding to this pandemic, and also to address and eradicating racism and poverty in our communities. I want to close with a quote by Angela Davis from her book, Freedom is a Constant Struggle. And she says, "It is in collectivities that we find reservoirs of hope and optimism." It is in our collectivities that we find reservoirs of hope and optimism. And I hope that by us being together today, and I echo what Professor Mousin said, that we are inspired by our resilience and our determination to be able to honor our humanity even when we face these challenges like a pandemic and administrations that may not take it seriously or that may marginalize our communities in specific ways. But if we remember that collective work and responsibility, if we remember Ubuntu, I am because we are, there is hope, there is optimism, and in the words of Angela Davis, there is freedom. Thank you for being with us today. I hope that you will stay connected with these phenomenal panelists and the work that they're doing, and stay connected with us with Community Renewal Society. Have a great day, everyone. Bye-bye.
Thank you.
Thank you.